Welcome to OOTO, the Out of the Office Investigation.
Mm.
I want you to imagine, just for a second, walking into a standard oncology ward.
Oh, okay, yeah, I'm picturing it.
Right. But instead of an IV drip or, a doctor handing you a pill, they hand you what basically looks like a tuning fork.
It's tuning fork, right. Or maybe they plug you into this low voltage battery charger.
Yes, exactly. And they look you dead in the eye, Jordan, and they tell you that they aren't going to use any chemicals to fight your disease today.
Wow.
Instead, they're going to vibrate your cells until the illness literally shatters.
Which, I mean, that sounds completely like science fiction.
Oh, totally. It sounds like one of those sketchy internet scams you see at 2 in the morning.
Yeah, the ones with the really bad pop-up ads.
Exactly. But today, we're actually cutting through all that noise to show you the real science of how your cells respond to electrical and sound resonance.
And the reason it sounds so wild, Alex, is because, well, we're completely conditioned to view the human body as this giant chemistry set.
Right, like an equation you have to balance.
Exactly. If you have a headache, you take a chemical pill. If your blood pressure is high, you take another chemical. It's a strictly biochemical model. But there's this entire other paradigm.
Bioelectromagnetics.
Yeah, bioelectromagnetics. And it argues that your cells are actually these highly sensitive electrical oscillators.
Which brings us to the absolutely massive stack of sources we are looking at today. I mean, we've got historical texts from the 1930s, we have 2026 medical reports, clinical trial data.
It's a lot of material.
It is. And our mission today is to trace the wild evolution of this field. We're going from the controversial fringe theories of these early pioneers through decades of, frankly, pseudoscientific internet claims, all the way to the rational clinical science that has resulted in modern FDA-approved frequency therapies.
Right. Because to understand how we got to modern devices, we really have to look backward at the people who first pushed this idea that human biology is governed by electrical charge.
And vibration, yeah. So we start in the 1930s with this American inventor named Royal Raymond Rife. And reading his claims in our historical sources, it is just a trip.
It really is. He was this optics and radio technician out in California, and he came up with this theory called the mortal oscillatory rate, or MOR.
MOR. Right, break that down for us.
So the premise of MOR was that every single microorganism, like every bacterium, every virus, has a specific, unique resonant frequency.
Like a biological fingerprint.
Exactly. And Rife theorized that if you could build a machine to broadcast that exact frequency into the body, you could cause the pathogen to physically vibrate to death.
Without harming any of the human tissue around it.
Right, because the human cells would be vibrating at a completely different frequency.
So Rife was trying to act like a soprano shattering a wine glass by hitting the exact right note, whereas Reich was basically trying to plug the human body into a giant battery charger.
Oh, wait, you're jumping ahead to Reich, but yes. That is a perfect analogy for Rife. It's called destructive resonance. But to find those specific frequencies for Rife's method, he had to actually see the live viruses.
Which was basically impossible back then.
Right. So Rife built what he called the universal microscope. He claimed this incredibly complex array of quartz lenses and prisms could magnify objects up to 60,000 times.
Which is just an insane claim. For you listening, a standard optical microscope maxes out at about, 2,000 times magnification?
Yeah, around there.
If you want to see anything smaller, like a virus, you have to use an electron microscope. But the process of using an electron microscope requires a vacuum, which, instantly kills the specimen.
Right, it destroys the very thing you're trying to watch. But Rife claimed his light microscope was somehow keeping these pathogens alive, letting him watch them swim around in real time.
And through this supposedly miraculous microscope, Rife claimed he discovered a specific microorganism he called the BX virus.
Yeah, the BX virus. And he declared that this one virus was the singular cause of all cancers.
Which is a massive leap. But it led directly to his most infamous moment, right? The 1934 Scripps Ranch clinical trial in San Diego.
Yeah, this is where it gets really wild. Rife claimed that a medical research committee from the University of Southern California brought him 16 terminally ill cancer patients.
And he didn't use any medicine. He used a machine called a beam ray.
Right, which was basically a plasma tube filled with noble gases.
And he used it to broadcast his specific frequencies into these patients for just 3 minutes every 3 days.
Just 3 minutes. And according to his own records, and we have to stress, his own records after 70 days, 14 of those 16 terminal patients were declared clinically cured.
Which sounds like a total miracle. But Rife's downfall was his absolute obsession with destroying the pathogen.
Yeah, he was so focused on the attack.
Right. But right around the same time, moving into the 1940s, you had other rogue scientists looking at the exact same electrical concepts, but coming to the complete opposite conclusion.
Like Wilhelm Reich.
Exactly. What if you don't blast the invader, but instead you charge up the host?
Which is where your battery charger analogy comes in. Reich was an Austrian psychoanalyst, actually a student of Sigmund Freud, but he went so far off the beaten path when it came to human health.
Rife wanted to destroy the disease. Reich was entirely focused on the energy of the patient.
Yeah. Reich believed that disease was caused by a drop in the body's biological charge. He called this life force orgone energy.
Orgone energy. It sounds like something out of a comic book.
It does. He even formulated this tension and charge equation. He found that feelings of pleasure and expansion actually increased the millivoltage of human skin.
Wait, really?
Yeah, and anxiety and emotional contraction actively decreased it. So to Reich, cancer wasn't a virus like Rife thought. To Reich, cancer was a shrinking biopathy.
Meaning the body's electrical charge was just simply draining away.
Exactly.
Yeah.
And his solution for this was to build these giant orgone accumulator boxes.
Boxes. This is my favorite part of the sources.
It's so bizarre. So Reich claimed he could see these shimmering blue energy vesicles under his microscope, which he called bions.
Lions. Okay.
And to stop these bions from decaying, he built these human-sized boxes out of alternating layers of organic materials like wood or cotton and inorganic materials like steel wool.
And the theory behind the box is fascinating, even if it was totally flawed. Reich believed the organic layers would absorb atmospheric orgone energy from the room.
Right, and the metal layers would reflect it inward.
So a patient sitting inside the box would essentially be sitting inside a biological greenhouse, just soaking up a massive concentration of electrical life force.
That was the idea, yeah?
Wait, Jordan, the most mind-blowing part of the sources was his interaction with Albert Einstein.
Oh, I know.
Albert Einstein actually agreed to sit inside one of these metal boxes to test biological energy. How did Reich possibly convince him to do that?
He literally just showed up at Einstein's house. It was in Princeton in 1941. And Reich somehow managed to show Einstein that the temperature inside the top of the orgone box spontaneously rose, even without a heat source.
Which should be impossible.
Right. For a few weeks, Einstein was genuinely intrigued. I mean, it looked like a literal violation of the laws of thermodynamics.
But Einstein eventually figured it out, right?
Yeah, he conducted his own controlled tests and concluded the temperature change was just standard thermal convection currents from the room. It wasn't a new form of atmospheric energy.
That must have been devastating for Reich.
Yeah.
Ultimately, both of these men met pretty tragic ends. They both believed human cells operated like batteries, and they both aggressively challenged the medical establishment.
And the establishment pushed back hard. Their labs were raided by the FDA. Their life's work was seized or destroyed. Rife ended up fleeing to Mexico.
And Reich actually died in a U.S. federal prison in 1957, right?
He did, yeah. He was imprisoned after violating an injunction against selling his accumulators.
It's a really dark chapter. And it created this lingering, persistent narrative of suppression. Even today, you see proponents claiming there's this massive medical conspiracy that hid a cheap cure for cancer.
Well, the mainstream scientific view maintains that their microscopes defied the laws of physics and their clinical results were never actually independently verified.
You're listening to OOTO with research by Paul Bulow. So, Jordan, if these 1930s theories were supposedly so revolutionary, why aren't they standard medical care today? Like, why isn't there a beam ray machine in every modern hospital?
The harsh reality is the total lack of peer-reviewed clinical data.
It always comes down to the data.
Always. Let's look back at Rife's 1934 USC medical report. That study was never actually published in a peer-reviewed medical journal.
Not a single one.
No, many of the doctors supposedly involved later distanced themselves from it, or they flat out denied it happened the way Rife described. There was no independent pathology to verify that those 16 patients actually had terminal cancer to begin with.
Oh, wow. So they might not have even been sick.
Or they had something else entirely. And there was no proof they were truly cured afterward. It was all purely anecdotal.
But despite that massive lack of evidence, you can go online right now and buy modern Rife machines. I mean, the sources detail consumer systems like the Spooky 2, which operate on pure pseudoscience.
Yeah, the Spooky 2 is essentially a software-based frequency generator. They have a few delivery methods, but the most controversial is what they call their remote mode.
This part is wild.
It is. They use something called a DNA holder. You basically place a fingernail clipping or a hair sample between two metal plates connected to the machine.
Wait, they use a fingernail.
Yes, a fingernail. And the proponents claim that through quantum entanglement, the machine can broadcast healing frequencies to your body no matter where you are on the planet.
Which is a complete fundamental misunderstanding of how quantum entanglement actually works in physics.
Yeah.
You can't entangle macroscopic objects like a fingernail clipping and a human body to magically transmit radio frequencies across the globe.
Absolutely not. It's nonsense. And the FDA categorizes these devices as unregulated general wellness products. They are strictly not approved to treat, cure, or diagnose any disease.
Let me push back on this for a second, though. Let's say you have chronic pain or you're just feeling awful. You drop a few $100 on a consumer frequency machine.
Okay.
Even if it is just a strong placebo effect and you magically feel better, what's the actual harm? I mean, the machines are low voltage. They aren't electrocuting anyone.
You're right that the physical electrical current isn't what harms the patient. The immense risk and the reason oncologists and the medical establishment draw a massive line in the sand is something called medical distraction.
Meaning they stop doing what actually works.
Precisely. When a patient relies on an unproven anecdotal device instead of an FDA-approved treatment, their condition just continues to progress.
And sometimes it progresses past the point where conventional treatment can even save them.
Exactly. Our sources document a specific case in 1997 where a man died just 4 months after stopping chemotherapy to use a Rife machine. That is heartbreaking.
It is. And in 2004, there was a 32-year-old man who died of testicular cancer, which is a highly treatable disease with an excellent survival rate.
Oh, man.
Yeah, he completely refused surgery in favor of a Rife device. The clinic owners who sold it to him were actually sentenced in federal court for fraud. So the distinction between a harmless wellness placebo and a life-or-death medical intervention is incredibly real.
Okay, so that is the immense danger of clinging to the unverified pseudoscience of the 1930s. But here is where the story gets really fascinating. The core concept, the idea that electrical fields and frequencies can actually impact human biology that didn't die with Rife and Reich.
No, it didn't. It actually evolved.
Right. It evolved from anecdotal claims into rigorous, rational, peer-reviewed science. The theory shifted away from Rife's idea of shattering a pathogen like a glass to a much more sophisticated biological concept called metabolic disruption.
Yes. Let's talk about the FDA-approved devices that use this, because this isn't fringe internet stuff anymore. This is mainstream oncology in 2026. All right, the sources highlight the Optune packs, which received FDA approval for advanced pancreatic cancer, and the TheraBionic P1 for liver cancer.
These are highly regulated, prescription-only, Class 3 medical devices. They are backed by massive Phase 3 human clinical trials, and they use a mechanism known as Tumor Treating Fields, or TTFields.
Wait, if this machine is sending electrical fields into the body to stop cell division, how does it know to only kill the cancer cells and not healthy human tissue? That was always the glaring hole in Rife's theory for me.
That's the genius of it. It doesn't rely on a magical one-size-fits-all frequency. Instead, TTFields physically interfere with specific proteins inside the cell called tubulin.
Tubulin.
Yeah. When a cell undergoes mitosis or, cell division, it uses tubulin-like microscopic scaffolding to physically pull its DNA apart into two new cells.
So the tubulin is the structural rigging that makes cell division possible.
Exactly. And the electrical frequencies of the TTFields are tuned specifically to the exact physical dimensions of the cancer cells during that division phase.
Oh, I see. Because cancer cells divide rapidly and aggressively.
Right, whereas most healthy cells in your body are not constantly dividing. When the electrical field interacts with that tubulin scaffolding in a dividing cancer cell, it creates a resonant physical force that literally tears the internal machinery apart.
The cancer cell tries to multiply, and it destroys itself.
Yes. And the healthy, non-dividing cells around it are completely unaffected because they don't have that vulnerable scaffolding deployed at that moment.
That is incredible. It's an electrical field calibrated to the physical architecture of a dividing cell.
It really is elegant science.
And the TheraBionic P1 device for liver cancer is just as wild. It uses a spoon-shaped antenna that the patient places directly on their tongue.
On their tongue, yeah.
It delivers 27.12 megahertz radio frequencies, modulated at specific rates straight through the body to target the liver tumors. These therapies are actively extending survival rates in rigorous clinical settings right now.
You're listening to OOTO with research by Paul Bulow.
Now, Jordan, TTFields are primarily used for targeted cancer treatments. But there is another branch of rational frequency medicine that has just exploded by 2026, specifically for pain, inflammation, and tissue repair.
Right. It's called frequency-specific microcurrent, or FSM.
FSM.
And FSM is completely changing the landscape of rehabilitation. While TTFields use electromagnetic radio waves, FSM uses microamperage electrical currents. These are applied directly to the patient's skin using conductive graphite gloves or wet towels or gel pads.
And to give you listening an idea of what microamperage means, it is an extremely low current. It's actually identical to the body's natural electrical current.
Right. It's very subtle.
Because if you've ever used a standard 10S unit for back pain that's transcutaneous electrical nerve stimulation that uses a much higher current that actively causes your muscles to twitch and spasm to block pain signals.
Oh, yeah. You definitely feel a 10S unit.
But FSM is so subtle you generally can't even feel it.
You can't feel it, but your cells certainly do. Research demonstrates that applying these specific microcurrents can increase cellular ATP by up to 500%.
500%. And ATP is adenosine triphosphate. It is basically the fundamental energy currency of your cells.
Exactly. So if you have a stiff neck or a lingering injury, the cells in that area are literally drained batteries. They're lacking ATP. Flooding them with microcurrent dramatically accelerates the healing of tissue, burns, and nerve damage.
Let's look at the actual clinical protocols because FSM uses a really clever dual-channel approach. Channel A targets the condition you want to treat, like, say, inflammation or scarring.
And channel B targets the specific tissue you want to address, like a nerve, a ligament, or an organ.
Right, and the precision is what makes the clinical data so strong.
Yeah.
Take the 2025 protocol for treating concussions or mild traumatic brain injury.
Yeah, a practitioner will run 40 hertz on channel A to reduce inflammation and simultaneously run 89 hertz on channel B, which is the frequency tuned specifically to the midbrain and cortex.
Or the protocol for systemic inflammation, like fibromyalgia. They pair 40 hertz for inflammation with 10 hertz for the spinal cord.
And our sources show this specific combination can reduce blood-borne inflammatory markers like cytokines.
Which are basically the chemical alarms your immune system sounds when there's a problem, right?
Exactly. It reduces those cytokines by up to 70% in just 90 minutes.
It is a massive biochemical shift.
Yeah.
And without relying on any pharmaceuticals.
Yes. However, we do need to be very clear about its regulatory status. FSM is FDA cleared as a 10N or microcurrent device for the relief of pain and improvement of local blood circulation.
Okay.
But it is emphatically not cleared by the FDA to diagnose any disease.
Right. You can't hook someone up to an FSM machine and say, based on these beeps, you have liver disease.
Exactly. But if they aren't using this to diagnose a disease officially, they must be using it backward in clinical practice.
Like a trial and error physical test to see how the body reacts.
That's exactly what they do. Practitioners call it the trial of therapy. When they apply a specific frequency pairing, they are feeling for a physical response from the patient's body known as resonant tissue softening.
Resonant tissue softening. Break down how that actually feels in a clinic.
Okay, imagine a patient comes in with severe burning neck pain, but their MRI is completely clear. The structural imaging shows nothing wrong.
Frustrating, but common.
Very common. So the practitioner will physically palpate or, feel the tight, painful tissue. Then they will apply the frequency for inflammation, which is 40 hertz, and the frequency for nerve, which is 396 hertz.
Okay.
If the patient's tissue physically softens under the practitioner's hands, going from feeling hard and restricted to feeling doughy and pliable within 30 to 60 seconds, and the patient's pain instantly drops.
Then the practitioner knows without a doubt the root problem is active nerve inflammation.
Yes. And if the tissue doesn't soften, they might pivot and try, say, 13 hertz and 62 hertz, which is the specific pairing for scar tissue in the fascia.
And if the tissue softens then, they know they aren't dealing with active inflammation at all. They are dealing with an old physical adhesion.
Exactly.
So instead of taking a structural picture like an MRI, FSM acts like a digital stethoscope. The practitioner is basically trying different digital keys in the biological locks of the patient's body until one turns, the tissue softens, and they know exactly what the problem is.
Sharing that digital stethoscope analogy makes perfect sense, Alex. It's about identifying functional resonance rather than structural integrity. It allows doctors to find hidden nerve entrapments or biochemical toxicity that a traditional MRI scanner simply cannot see.
It is just incredible to see the full scope of this evolution.
Yeah.
I mean, we started our investigation in the 1930s with Rife trying to aggressively destroy disease by shattering pathogens.
And right building literal metal boxes to capture atmospheric energy.
Right. And now, almost a century later, we have transitioned into this highly regulated era of restorative bioelectromagnetics.
We aren't guessing with plasma tubes anymore. We have phase 3 clinical trials proving that specific radiofrequencies can halt cancer cell mitosis.
And we have precise microcurrent protocols increasing cellular ATP to resolve neuroinflammation.
It's the triumph of the rational scientific method over anecdotal vitalism.
It really is. But before we wrap up, Jordan, I want to pivot one last time, because we have spent this entire discussion talking about external machines.
Plasma tubes, TTFields generators, microcurrent gloves.
Exactly. But the sources show that you don't actually need a high-tech medical device to influence your body's frequency.
No, you don't. And this is perhaps the most empowering piece of the research we found. Our cells are electrical oscillators, sure, but the human body comes with its own built-in frequency generator.
You were talking about vocal toning.
I am. The clinical data shows that self-produced sounds like humming, chanting, or singing provide unique biochemical and mechanical benefits that no external machine can replicate.
That's wild. How does that work?
Well, when you hum at a low pitch, say somewhere between 100 and 150 hertz, you are physically vibrating your vocal cords.
And the vagus nerve, which is the superhighway of your body's rest and digest parasympathetic nervous system, passes right next to those vocal cords in your throat.
That physical proximity is key. Humming mechanically massages and stimulates the vagus nerve. That stimulation leads to an immediate drop in heart rate, a reduction in blood pressure, and a decrease in cortisol.
Just from humming.
Just from humming. Furthermore, a 2026 clinical review confirmed that the physical vibration of humming causes the air in your paranasal sinuses to oscillate.
Okay.
This oscillation increases your body's production of nasal nitric oxide by up to 1,500% compared to normal, quiet breathing.
Wait, a 1,500% increase.
Yeah.
And for you listening, nitric oxide is a massive vasodilator. It physically opens up your blood vessels, improving oxygen delivery to your brain and your tissues.
It is a profound physiological shift. And when you extend your exhale through humming or singing, you naturally align your heart rate, your blood pressure, and your breathing rhythms to a specific resonance frequency of 0.1 hertz.
0.1 hertz.
Yeah, and at that exact frequency, your body's stress resilience and heart rate variability are completely maximized. We carry a powerful restorative frequency generator right inside our own throats, and it's completely free.
It is an amazing full circle moment. We started today talking about a soprano shattering a wine glass with a specific note. For decades, we thought of frequency as a weapon to be used against disease.
But the real science shows us that frequency is a restorative tool.
Exactly. Whether it is an FDA-approved device specifically targeting the structural scaffolding of a cancer cell, or just the simple resonant vibration of your own voice calming your vagus nerve, the right frequency can literally change your biology. The next time you feel overwhelmed or your body aches, before you reach for a chemical fix or search the internet for a miracle machine, remember that you have the power to change your own resonant frequency with a single breath. Thank you for joining us on this investigation.
Always a pleasure.
This has been OOTO. We'll see you next time.